And a good Tuesday morning to you, 100.9 FM, 13 WMVO, WMVO.com's AM Knox County program. Thanks for joining us here today. Presented by Homes Rental and Sales. Tyler Mathias with you, and we're talking Dr. Jim Jenkins with Swetlic Chiropractic and Rehabilitation. I was telling Tiffany, I try to guess which one's coming in. I knew Dr. Swetlic was here last, so I threw it up 50-50 shot. You were Dr. Overholt. And then I remembered when I left you in here when I had to go the last time you were going to be here. So, Dr. Jenkins, appreciate you joining us here on the programs. We're going to be talking with Swetlic Chiropractic and Rehabilitation today, and also Mayor Matt Starr will come into the studio and chat with us here today on AM Knox County. And don't forget, tomorrow night we've got high school girls basketball as the Danville Lady Blue Devils take on Shekinah Christian, and that's a pregame at 6:45 tomorrow night around that time, and we'll tip right at 7. So we're excited for that. Tournament time's a lot easier, Dr. Jenkins, because you know what time it starts. So it's a little different when in the regular season. But Dr. Jim Jenkins with us. We appreciate him joining us. I talk hoops because he used to be an official, and I know they're in high demand right now, so he's probably got like 10 voicemails or something. But no, we appreciate Dr. Jenkins joining us. Tell us a little bit about what you do at Swetlic Chiropractic and Rehabilitation, Doctor.
Well, at Swetlic Chiropractic, I'm the physical therapist, and I have the good fortune of not only doing the evaluations of all of our patients that come in for physical therapy, but also get to do the treatment. So I get to guide the individuals along as they get better. And, of course, it's always a pleasure working with our chiropractors as they make adjustments that actually work well in concert with the physical therapy that we do with the patients and try to get that whole person better and back to the things that they've been missing.
Yeah. Some people that get treatment can say, hey, I got treatment, and then they're going to be okay. Others, they've got to go through, like, obviously some physical therapy. I remember I kept rolling my ankle, Dr. Jenkins, and it got to a point where I needed physical therapy on my ankle to strengthen my ankle because I had rolled it so much. But in this kind of situation, it's Swetlic Chiropractic and Rehabilitation. It can be somebody that's received treatment or somebody that's been referred over to that you're able to assist.
Exactly, and we treat a wide variety of conditions, and it really matters little as to whether or not you're eligible for services at our location as to whether the injury is an acute one, something that has just happened recently and actually limited your function and your lifestyle and things that you feel comfortable with, as well as your pain level. Or it can be a chronic injury that has been plaguing you for a while, and it's like, oh, it's time that I do something about this. And, of course, you can have an acute on chronic injury where something has bothered you, but just like you strained your ankle, you can actually make things worse, and it's a matter of, do I actually get this taken care of and try to get more back to my functional lifestyle, or do I just grit my teeth and bear it?
Yeah. Like as if your back's hurting you all the time and things like that, but then a couple of days you're going, I'm feeling a little bit better, and then that one instance you go pick up that pen and then boom, your back's out. Is that what you're referring to, kind of?
Well, the wonderful thing about back pain is that 80% of Americans will experience an episode of low back pain or mid-thoracic pain in their life, and most of those situations resolve spontaneously. In other words, you don't need a clinician, you may not need medications to actually get that to calm down. But there are a large number of people, if you're talking about 80% of the American population, that will have that nagging injury, and it's best to have that assessed and rule things out because it actually can lead to all sorts of compensations where other body parts are trying to compensate for your pain, and you try to move around them, and you wind up hurting some other body parts as well.
We talked with Dr. Swetlic before, too, about your core and the importance of strengthening your core and things because, it can lead to issues with your back. And so do you work a lot on your core for the physical therapy side of this?
We certainly do. And it's not just a matter of core that becomes central to the issue, but we know that as all parts of the body are connected, we actually look at the whole person so that virtually from the ground up, we say that when the feet hit the ground, everything changes. So that when we actually look at an individual, something that is happening at the ankle can be manifested or seen with how that person's posture is somewhat changed up at the torso or their head position, and that could lead to problems and tightness and pain further up the chain.
I talked to Dr. Swetlic one time and with some back pain, and he looked at the x-ray and he looked at my leg and how my leg was just, and not in the right place, and then one leg shorter than the other and all this different stuff. So all these different pieces to that. But, I know you in addition to getting the referrals from whether it be Dr. Swetlic or Dr. Overhaul as well, you take outside referrals as well, right? I mean,
we certainly do. As long as you have a referral from your primary care physician, and we do take referrals from a wide variety of clinicians, whether it be nurse practitioners, podiatrists, dentists, because we do treat injuries such as TMJ, so that if a person does have any prescription for physical therapy, we can actually treat that illness with that script.
We talk so much about the back, and that's you talked about the 80% there, but you guys can help people, whether it be a rotator cuff or hamstrings, to strengthen different things.
We treat people from head to toe.
Yeah.
We work with folks that have headaches, whether they be migraines, neck pain, shoulder pains, postural issues. If they have congenital disease that they may actually, have MS difficulties or cerebral palsy. But we take it right down through the body and we treat what we see. And often diseases and injuries are interconnected because the body will make adjustments. We find ways to get it done. If you get up in the middle of the night and you stub your toe on the nightstand, you don't have to think too long about how you're going to get yourself to the bathroom. You wind up becoming a hopper, and you can actually, get things done. But those injuries tend not to last long. But, when we deal with some of those injuries that don't resolve relatively quickly, that's when our services sometimes are sorely needed.
Yeah. The chronic issues, they have got to be more difficult for you because, and maybe I'm wrong there, but because you almost have to train the muscles to get back to where they're supposed to be, right?
And that's the challenge, is that when we do have chronic injuries, the body makes a series of adjustments. And I like people to, particularly in this day and time when folks have had some challenges getting outside of the home, and some clinics are a little busier and actually can't get patients in as quickly as possible, using our 5 senses to actually assess, okay, where's my body actually going with this and what really has gone wrong. So if we kind of look at what the body can actually offer us in terms of using our eyes, using our nose, using our ears and taste and touch, to actually assess where we are. Let me give you a quick example. Once our body actually learns to list or lean to one side because of either back pain, knee pain, hip pain, our brain actually starts saying, it is normal for me to walk in this fashion. And usually the individual will feel normal with that shoulder tilted down, head listing to the side, bobbing from side to side, almost walking like a penguin, and not feeling unusual about that. And actually using your eyes to get some mirror feedback and say, ooh, I didn't even know that I had actually made this adjustment. It feels normal to me. So we work at not only fixing the injury so that a person has the ability to get better, but also just trying to make sure that they adapt or adopt new habits so that they walk in that better fashion.
Dr. Jim Jenkins is with us, Swetlic Chiropractic and Rehabilitation, here on this Tuesday. AM Knox County, presented by Homes Rental and Sales. We appreciate you joining us here today. We're going to take this quick break, and we'll come back, and more of AM Knox County is coming up. Welcome back, AM Knox County, presented by Homes Rental and Sales here on this Tuesday. Thanks for joining us, Dr. Jim Jenkins with Swetlic Chiropractic and Rehabilitation. They're on Upper Gilchrist Road in Mount Vernon. And Dr. Jenkins would get this. I wouldn't get lost going there. Let's just put it that way. There's a running joke of me not getting anywhere, but I could get there with the GPS. No, just kidding. I wouldn't even need that. You were talking a little bit before the break, though, about common senses and using your senses. Tell us a little bit more about how that can help us.
Well, we have a number of people that would like to get into either chiropractic or physical therapy treatment sooner than we may have availability for them. When they do come in, I always ask them a series of questions about the nature of their injury, and it usually comes down to a matter of were they, truly observant of things that, have been happening with how they move, how they feel. And so I will, query them or ask them questions about, those things that they observe in terms of whether their posture has actually started to deteriorate. Do they look different when they look in a mirror? And it is amazing how many of us don't look at ourselves. We often say, it's like, oh my goodness, I don't like to look at myself in the mirror. And even when we do, we have the impression we have a picture, an image in our heads of what we look like. So we may be shaving, we may be putting on makeup, or doing our hair for those of us who are fortunate enough to have some. And we don't even notice if details have changed, if we actually have some swelling. If we're looking at ourselves in the mirror, we may not notice that one eye sits lower than the other eye, which might be an indication that we may be having some neck pain or shoulder pain as we list a little bit. So I try to have people, get comfortable with noticing what they look like. If they actually have some difficulty with their ears, those things might actually lead to an inner ear problem. The inner ear actually has much to do, because of semicircular canals, with your balance. So your walking issues, do they also give you some challenges with dizziness, being able to maintain the path that you're trying to walk? Along with the ear problems, you may actually have more difficulty with chewing your meals. Well, you might know where that came from. Did your bridge come out? Do you have a toothache? Are you chewing on one side of your mouth a little harder than you are on the other side? So it's not just a matter of what actually hurts today, but what actually led to that, what is different about your body, and these are the habits that we may be able to get you out of, so the problem doesn't come back.
And talked about the ears there. How does it taste? How does it taste to help you to determine, if you might have some issues, doctor?
Well, there are a number of tests that we do, and there are some vestibular tests where you can actually have the sensation that you are sitting in a still place and the room is moving about you. You might have a different situation where you are feeling that you are losing your balance and you're moving within a stable environment. So running a number of tests, ensuring that we are not looking at a more significant issue with circulation towards the brain, some basilar artery tests to actually rule out some issues with the neck, both in terms of nerves as well as circulation at the neck, need to be ruled out before we start dealing with the muscular or the semicircular canal issues.
Dr. Jim Jenkins is with us, Swetlic Chiropractic and Rehabilitation. Any other senses that maybe people come in and you recognize right out the bat and you say patients are maybe having some issues with?
Well, so oftentimes it may be related to diabetes with some people, but their touch in terms of their light touch sensation may be altered, where they cannot feel things, or their touch may be fine, but they actually cannot hold on to things. They are dropping items more frequently. We see that with folks that, might be working in a kitchen, whether you're a housewife or a cook. But we also see that with some of our mechanics who might be wrenching on a vehicle, and it's like, man, I keep dropping the sockets and the wrenches, and I can't do what I need to do. Is the problem always out in the fingers? No, it might actually be at your neck, what we call a brachial plexus syndrome, where some of the radiation of the difficulty when nerves are compressed further up along the system actually create some problems out at the fingers. So doing a thorough evaluation becomes essential so that we can see what the source of the problem is. And Tyler, it's like if you have a flat tire, or if you just have some wear that is uneven on your tires, replacing a tire, well, that actually fixes the symptom, but it might be something more significant. You might have wheel bearings that are shot. You might need an alignment on that car. So you can fix the obvious problem that presents, but getting to the heart of the matter can actually fix your long range.
Yeah. And again, Dr. Jim Jenkins is with us, Swetlic Chiropractic and Rehabilitation. We talk about, fixing things long term, and, somebody comes in and they maybe get assistance for 2 months, maybe it's 2 weeks, or maybe it's 2 years or something, but doing things at home and doing things on your own time, that certainly helps. Almost like playing basketball. People say, well, yeah, you have basketball practice, but when you play on your own, then you're going to get better. And it's almost the same thing when it comes to getting physically healthy.
And it's just like when we work with athletes, it's not just the matter that they do something when they're not at practice or in a game, but they tend to do the right things that reinforces the better habits, the better body alignment. And some people actually just don't like to do exercise. I know you're a fit person, Tyler, so you don't fit in that category.
They're going to be shocked out there when you saying that. My head's not going to fit through the door. Thank you very much. You're welcome to come in whenever you want, Dr. Jenkins.
But the fun piece of what I try to get people to look towards is that we've often heard that recommendation of 150 minutes of moderate exercise during the course of the week tends to give you some cardiorespiratory health, some longevity in terms of making your life a bit longer, if not healthier. There are so many things that a person can and should do, and look at their daily activities as exercise. How many of us shovel snow? Do we actually have to vacuum our house? Just washing the dishes, loading the dishwasher, or bending over to retrieve your laundry out of your dryer and standing to fold that. How you stand when you're walking through the shopping mart. You can practice standing on one foot to work on your balance. So there's so many small things we do that actually train our brains to be functionally more efficient, but also work at reducing our pain because we're not in those lousy postures.
And we have just a minute or two here left, but I know here in Ohio, you get this wonderful thing called snow, and you got to shovel it. And it seems like a lot of people can have back issues because of having to shovel snow and do these different things. And do you see that at Swetlic Chiropractic and Rehabilitation there?
We certainly do. And the piece with doing anything that is repetitive and somewhat heavy and that your body really is not conditioned to do is to actually be aware that, okay, I might have to actually, take a break and actually not shovel continuously. If we have the skill to shovel using the left hand forward instead of the right hand forward, we may not overuse some muscles always throwing that snow over our dominant shoulder. And sometimes you can push the snow across the driveway rather than throw it over your shoulder. So all sorts of little recommendations can keep a problem from actually appearing when it's something unusual and tough.
Moderation is a key, I guess. That's what I've always been told. I have heart problems, and they say, Well, don't shovel it for too long. You'll have a heart attack or something. So, but no, shout out to my neighbor, by the way, who actually plowed my driveway the last time. I mean, but Dr. Jenkins, we appreciate you joining us here. So if people were maybe saying, hey, I've just had back pain for a while and I heard this radio show, or I've just had some acute physical pain and want to get in touch, what's the best way to get in touch with Swetlic Chiropractic and Rehabilitation?
Yeah, well, they can actually, stop by the clinic if you know where it is on Upper Gilchrist Road. We're at 11301 Upper Gilchrist Road, right down from the radio station here, or you can phone. And I cannot promise that the phone won't be so busy that we can answer on the initial call, but leave a message. We'll get back to you. That phone number is 740-392-1407. And you can always send us, a message at painfree@swetlichealth.com. And we'll communicate back to you and get you into the clinic.
All right. Dr. Jim Jenkins, it's always a pleasure. I didn't run out the door when you came this time, so there's another running joke there. But we do appreciate Holmes Rental and Sales, our AM Knox County sponsor. Always great to catch up with Swetlic Chiropractic and Rehabilitation. Dr. Jim Jenkins here today.